بأيدي سفرة كرام بررة قتل الإنسان ما أكفره من أي شيء خلقه من نطفة خلقه فقدره ثم السبيل يسره ثم أماته فأقبره ثم إذا شاء أنشره كلا لما يقض ما أمره فلينظر الإنسان إلى طعامه أنا صببنا الماء صبا ثم شققنا الأرض شقا فأنبتنا فيها حبا وعنبا وقضبا وزيتونا ونخلا وحدائق غلبا وفاكهة وأبا متاعا لكم ولأنعامكم فإذا جاءت الصاخة يوم يفر المرء من أخيه وأمه وأبيه وصاحبته وبنيه لكل امرئ منهم يومئذ شأن يغنيه وجوه يومئذ مسفرة ضاحكة مستبشرة صدق الله العلي العظيم. الفاتحة. تسبقها ذكر الصلاة على محمد وآل محمد.
Thank you, Brother Mustafa, for the beautiful recitation. Can we give him another loud salawat? Assalamu alaikum. Again, I welcome you to our Friday night program. This is a collaboration between the Muslim Youth Connection, the Faith Community Health Initiative, and the Islamic Institute of America. A quick reminder before I pass the mic over, make sure you're wearing your face masks at all times. And please make sure you're sitting on a piece of tape underneath you. That way you're properly socially distanced. With that, I'm going to pass the mic over to our moderator tonight. She's Dr. Maha Al-Husseini. She is an endocrinologist at Metro Detroit Endocrinology. She is also a member of the Faith Community Health Initiative. Can we please welcome her with a loud salawat ala Muhammad wa ali Muhammad?
Assalamu alaikum and good evening, everyone. On behalf of the Faith Community Health Initiative at the Islamic Institute of America, we are pleased to present to you this educational session on the COVID-19 pandemic and the current vaccines available. There is no doubt that we are living in uncertain and challenging times in many aspects. Just like we have an array of information available at everyone's disposal, we also have an equal amount of misinformation. The result is confusion, lack of trust, and the inability to make informed decisions. Since knowledge is power, the Health Committee at the IIA has put together a group of panelists from different backgrounds in order to share their respective expertise with the community. Today's panel includes Dr. Hammami, the Chief Health Strategist for Wayne County, who has been a prominent figure in leading the response to the COVID-19 pandemic in the area. Previously, Dr. Hammami has served many roles, including serving as the Chief Health Officer and the Director of the Department of Health, Veterans, and Community Wellness in Wayne County. Today, Dr. Hammami will be educating us on the COVID-19 pandemic from a medical standpoint, as well as providing us with an update on the vaccine situation. Our second speaker will be Michigan State Representative Mr. Hammoud, who will be speaking about the response at the federal and state levels. Last but not least, our final speaker will be Imam Sayyid Hassan Qazwini, who will be guiding us on making sense of this pandemic and vaccine therapy from a religious and spiritual perspective. In the end, we will have a Q&A session, so if you can please leave your questions until the end of the session. Without further ado, I'd like to call upon our first speaker for today, Dr. Hammami, who will be covering the medical aspect of this session.
Thank you, Dr. Muna. Assalamu alaikum, everybody. Good to be here and glad to be back. I have had so many, I was honored to be with Sayyid Qazwini on a couple of occasions, including how we interact with our community. And I echo what Dr. Muna said. There is a lot of misinformation that is circulating out there, and I'm sure many of you belong to at least one, if not more than one group of WhatsApp, and you see all those videos that are coming from the old country, from the new country, and from no country sometimes, which is truly disturbing because these misfacts can affect those of us that have the hesitancy. We as human beings have the hesitancy and the reluctance and the fear of anything that we do not know or we do not understand. And the best thing to tackle anything that you do not know is with facts and with science. So sometimes, unfortunately, many of those rumors are sugar-coated with some scientific flavor, and it becomes very hard to convince people about many of the things that they know. And at the end of the day, this is going to affect how we react, and specifically our community. Our community has been one of the hardest hit during this pandemic, not because of anything that we did wrong, not because of who we are, not because of what we believe in. Our community has been hit the hardest because there are some cultural understandings and cultural behaviors that are part of how we live. We are more social than others. We live as big families. There are generations that share the same household. We tend to be passionate about the things that we believe in addition to also that we saw the disparities in how this pandemic has been affecting different ethnicities and different minorities, and that is evident in why we see it more in our communities versus others. So with that intro, I know there were several questions that I was asked to cover. Some of them are very basic about the disease itself. I'll try not to spend so much time on it, and I want to spend a little bit more time on the vaccine itself, which I'm sure many of you are eager to know more about. And then I would like to leave more time for a dialogue and for conversation where I can answer any of your questions that you might have. So starting with the basic of when we talk about COVID-19, which is a disease that is caused by the SARS-CoV-2, or more known as the coronavirus. When we talk about viruses, viruses are different than bacteria. Bacteria are pathogens that infect the body in a certain way. With viruses, there is more an invasive way where a virus goes into someone's cells and inject its own genetic material, and it starts using your own body to duplicate and replicate. And this is how viruses reproduce inside our body. And each virus, of course, has its own characteristics of what it attacks and all that. So the SARS-CoV-2 is called a novel virus because it is new. But in reality, it is not very new. We have had encounters with members of its family, specifically the coronavirus. If you remember, in the 2000, there was the SARS, and it didn't hit the US as much, but it was very specifically known in China and all that. So SARS is a coronavirus. When in the mid-2000s, there was the MERS, the Middle Eastern Respiratory Syndrome, and that was mostly in Saudi Arabia and the Middle Eastern countries, and it was thought to be transmitted by camels, and this is why it was there. This was also a coronavirus. So this one that we have seen is from that family, but it was new because it had a whole different characteristics of how it acts. So how does the vaccine enter, how does the virus enters your body? Specifically, this one is transmitted via respiratory systems. So droplets are the first way that it travels. Someone coughs or sneezes or even talks loudly, then it is believed that 6 feet, and this is why when we say social distancing for 6 feet, this is how far those droplets would travel. And those droplets would contain the virus. So someone that is sitting closer to you than 6 feet, and let's say you sneeze or you cough or even breathe, sometimes that droplet can be inhaled by the other person, and once it's inhaled, if it contains the virus, it goes into the body. And as we said, the virus itself, why is it called corona? Because, and the reason, and I'm not going to be too scientific about it, but the reason it's called corona because many of us have seen a picture of the virus by now, right? It's a big ball and it has spikes. Those spikes are like a crown. It's like a tag around the virus. And this is why it's called coronavirus, from the crown. Those spikes are responsible for sticking to the human cell. They're called receptors. So those spikes go, and there are receptors on our cells, and those spikes now adhere to our cells, and this is how it goes into our body and starts replicating or duplicating. This virus is, again, a respiratory virus. What made it a little bit more, I wouldn't call it deadly, but at least scary, or one is because it's new. We don't know enough about it. Two, because it reacted in very unpredictable ways. So some people would have it, they would not show any symptoms, and we call those asymptomatic. And these are dangerous because you don't know that you're sick. So if you're not sick, you're not staying home. If you're not sick, you're feeling well, then you're out and socializing and doing all kind of stuff. But you carry the virus and you're spreading it. So this is the worst way to carry the virus. Then there are those that are symptomatic, but it's very mild. It's a slight fever, slight runny nose, as if you had the flu. You don't really know what to do. It doesn't last long and all that, and we call that mild. But then there are the severe cases of this, and of course the proportion of the severity is proportional to the age. Young people, when they get the virus, they probably are asymptomatic and have very mild symptoms, but as the older gets it, the older population gets it, this is where the severity becomes harder. And in some cases, because it's a respiratory virus, because it affects the function of the lung, it then affects the oxygen exchange. Oxygen is very important. And this is where if someone goes into what we call hypoxia, which is a lower level of oxygen in their system, sometimes it can go to a complete shutdown of the body system, and we call it complete dysfunctioning of the body, where it can lead to death. So these are the early cases that we started seeing. It was a new virus, and if you remember in March and April, we were seeing very high death rates of this virus. The reason is two. One, because it was affecting, we were discovering it in the elderly the most, because those were the ones that reacted to it most severely. Those were the ones that had to be hospitalized and go into the intensive care unit and be put on ventilators. And also the elderly, whether we like to admit it or not, when we get older, then there are so many other conditions that we might have, which we call comorbidities. And comorbidities, it means I might have diabetes and now I have this virus, or I might have asthma and I have this virus, or I might have hypertension and I have this virus. So all that is going to put a burden on the human body and react to it in a different way. So every infection that is known to mankind, even the flu, which we all get at some point in our life, if it hits someone that is medically fragile or their health system or their immune system isn't as healthy, can lead sometimes to severe illness and sometimes can lead to death. So the fact that this virus is causing death isn't something that only specific to this virus. However, because we were seeing it in big and massive numbers, then the percentage of how many people die from this virus is a little higher than all the other viruses. And because it was new, this is where it was shrouded with all this fear and paranoia, and we call it deadly. Not that I'm saying it is not a serious matter that we need to not take into consideration, but it certainly is something that is a characteristic of every virus. And this is where common sense and the practices that we practice can curb that deadly virus and can protect us from it. So before we get into the vaccine, which is one sort or one method of prevention, the best way to prevent you from catching any infection, let's forget about coronavirus for a while, whether it's the flu or whether it is anything that is contagious, is proper and common practices that even in our religion we are encouraged to use, right? Hygiene, washing, keeping yourself clean, washing your hands, making sure that whenever you touch something, you wash your hands and all that. The second is the physical distancing. Again, we're talking about droplets that can travel for a distance, so keeping that distance is going to minimize you catching that. And finally, this piece of cloth that we are all wearing, which unfortunately, for many other reasons that we're not going to talk about here, has been so politicized, and it has been also marked as whether you are brave or not, or whether you believe in conspiracy or not, or whether you are blue or red or green or whatever. And it became a symbol for people that are either so fanatic and so religious about wearing the mask, or people that are also so fanatic and so religious about not wearing the mask. But if we see all the studies that have been produced out, we know that masks are working. If we see just between November and January 8th, so remember, November, before Thanksgiving holiday, there was the governor directive that we need to shut down, and she advocated against gathering, and all the restaurants closed down, and there were restrictions, masks were mandating and all that. Until January 8th, which is, again, Christmas, Thanksgiving, and New Year's, it is believed through predictive models that Michigan was able to prevent 150,000 deaths because of those simple three things: masking, distancing, and washing your hands. So imagine if everybody else can do that, and we were able to do that right when we saw the spikes in April and in May, and when everybody shut down. We were saying we want to slow the curve, if you remember that term, slowing the curve. This is when people were really strictly adhering to those three things. We saw the spike again, or the raise in the cases back in June and July, when we became relaxed. We became, oh yeah, we rode the wave. We flattened the curve, but then, because we became a little careless, if I may say, then we saw that spike. And this is why I keep saying we are not out of the woods yet. It is not time to celebrate. We will have plenty of time to celebrate, and I promise you. But as we are seeing cases dropping down, that doesn't mean that we should lower our guards, and it certainly doesn't mean that we will go back to normal immediately. However, some tools that are going to bring us closer to get back to normalcy is the vaccine. Now, before I tell you about the vaccine isn't the magic pill that is going to prevent everything. But if you heard the analogy of the Swiss cheese model. You know the Swiss cheese, a piece of cheese with holes, right? So you have one slice, and you put it, there are so many holes. You bring another slice of Swiss cheese, and you put it on top. The holes aren't identical, so now some holes are covering the other holes. You put more layers, and at the end you have a block of cheese that has no holes at all, because all those holes are compensating for where they are. And this is exactly what we're doing. You have prevention, which are the mask, the distancing, and the hygiene. You have the vaccine, that's another layer of cheese. You have the treatments, you have all that, and this is where we can make sure that this virus is no longer a threat. So, speaking of the vaccine, so remember we talked about the virus, big ball with spikes. These are receptors. The vaccine is a technology, so in the old times, the way vaccines were developed is we take the virus itself, we make it weak, and this is what your children get, right? The polio vaccine, all those vaccines, and Dr. you know probably better than anybody else, this is how we make vaccines. We weaken the virus, we inject it in the body, we force the body to recognize the virus in its weakened form, and it builds antibodies against it. So when the virus comes in its full form, then our antibodies attack it and kill it. This is a new technology that is called messenger RNAs. The messenger RNA is part of the genetic code of the vaccine that we took, not we, but scientists took, and they rearranged some of the genetic code, and they inject it in the body to force your cells to make antibodies against the receptors, those spikes that are on the virus. So now your cells are building proteins that will recognize those receptors and blocking them. When these are blocked, the virus goes into your body, and what happens? It cannot stick to any of your cells, so it cannot duplicate or replicate. It cannot use you as its host, and the virus disappears eventually because there is nowhere for it to reproduce in your cells. And this is exactly how this vaccine, the two vaccines, the Moderna and the Pfizer vaccine that you heard so much about them, this is how they work. And because they are not containing any of the particles of the virus, then they're even safer than the polio virus that is a weak virus. It is safer than all the life-saving vaccines that we know where we would inject parts of the vaccine, parts of the virus. So in terms of comparing it to what we have been living with, the life-saving vaccines, this is even a safer technology, okay? Now, many of you would say, and the rumors are saying, well, usually vaccines take at least 3 to 5 years to produce. This one was done in 6 to 8 months. Something doesn't sound right. I heard it from so many people that say sala'u. Remember, you know, sala'u, amlu bisara. It didn't pass all that. Well, here's one of the facts that were misrepresented. Remember I mentioned that we knew enough about the coronavirus family. We talked about SARS in 2000, MERS in 2006, and all that. The messenger RNA technology was done studying those vaccines. The technology has been mastered. All they needed to do, so let's say I have this piece of paper, this is the messenger RNA, right? So all I need to do is bring now this genetic code of the new virus, apply it to this, and now I have a new vaccine. And if this virus changes and we have a new virus, the technology is mastered. We have done so many extensive research and experiments on it. All we have to do is add a piece to it, and this is how it works. So it wasn't done overnight. And for anything to be available for human consumption, even aspirin, anything that is as simple as aspirin or a complicated drug that cures cancer, it has to pass so many rigorous tests and studies and research and trials. And you hear about phase 1, phase 2, phase 3. These are experiments that have to go through all the phases and then given to a large number of people, 30,000 for Moderna and 40,000 for Pfizer, where they were assessed and monitored and all that until the FDA, the Food and Drug Administration, which is the highest authority for anything that is put in the market or given to humans as a therapeutic agent, has to allow it to happen. So when you hear that the vaccine is available, it could have never been available, no matter what, whether it's the president or the vice president or this party or the other pushing for it. Science always prevails. Those are independent scientists that have no political affiliation, that have no allegiance to anybody but to science and to making sure that mankind is protected and it is something that is going to be beneficial. Now, with that said, yes, it is a new vaccine. But new in terms of that we are now testing it or giving it to people. And there is a period where we are going to see over this year to see how effective it is. In clinical studies, it has shown to be effective 95%. And many people say, well, what does 95% effectiveness mean? So the two vaccines that we're talking about, Pfizer and Moderna, has proven to be 100% effective in lessening the severity of the virus. What does that mean in simple words? That means if any one of us here has the vaccine and got exposed to the virus, then chances are if we get disease, it will be very mild. Remember I told you this flu-like, you don't feel good for 24 hours, some sneezing, some fever and all that. So this is 100%. You are not going to see anyone that is vaccinated. You are not going to see anybody that is going to critical condition, need to be put on ventilation, need to be admitted to the hospital, severe lack of oxygen and pneumonia, severe pneumonia and all that. That is 100%. In 95% of the cases, you will not have an infection period. And this is what we mean by 95%. So you bring 100 people, you vaccinate them, 95 of them will not have an infection period, and those 5% that might have an infection will have it in a very mild way that is not even going to require anything but supportive therapy, so no medical intervention. So that's when you hear 95% effectiveness or 94%, which are the Moderna and Pfizer. Now we're going to learn about new vaccines that are going to be available more. Some of them are 60%, some of them are less than that. So this is what we mean by effectiveness. What happens if we don't get vaccinated? Simple. If you don't get vaccinated, then you're not protected. If your child is not vaccinated at 2-month, 4-month, and 6-month, right? These are the life-saving childhood immunizations that protect against diphtheria and pertussis and tetanus. If your child is not vaccinated, what do you think happens? They are going to get those diseases because they're going to go to school and someone is going to have it. If your child is not receiving the MMR vaccine or the measles and rubella at 18 months, and they go to school and someone has rubella, then your child is going to have it. And we saw several years ago when the anti-vaccine movement was happening and people decided we don't want to vaccinate our children, we saw a recurrence and some big infections in California and elsewhere with the measles. That was because they're not protected. So it is simple. What happens if you don't wear a coat and you go out in the snow and it's very cold? You're not protected. So the coat is your protection. The vaccine is a protection. What happens if we all decide we're not going to wear masks and we're not all vaccinated? Some of us are going to get sick, especially if someone carries the virus. So that's what happens when we don't get vaccinated. But what happens when we get vaccinated is, again, some of us will have 100% immunity. Some of us will have 95% immunity. But overall, most of us will be immunized. And those that are not immunized are going to be protected because most of us are immunized. So this is, when you hear the word herd immunity, the simple explanation of herd immunity is that the majority are protecting the minority. At the end of the day, let's say everybody has a chance to get the vaccine. There are still going to be a very small percentage of people, because of medical conditions, they cannot get the vaccine. There's a contraindication to get the vaccine. But if everybody else around them is vaccinated, then they are protecting those that are not vaccinated. And this is what herd immunity is about. In order to establish herd immunity in our community and our extended community, and oh, there you go. Good. So there are two more questions and then I'll stop. One that, again, many of the rumors, many of the facts or misfacts are about what is called the new strain. We hear about the United Kingdom now, the B117, we hear about South Africa, and again, everyone is panicking, and it is quite normal. We all fear what we do not know, right? We all fear what we do not know, and it's acceptable. But how do we eliminate that fear inside us? By seeking to know more and seeking facts. Viruses, any virus, even the flu virus, part of their normal evolution, part of their normal life is to go through mutations. And by mutation, that means they change some things in their genetic code and they evolve. They do not create a new virus, but they improve that virus, and it is part of their survival. The flu virus that we get every year goes into 2,000 different variants every year. But we don't hear about it because we're used to it. It's part of what we know, right? We don't fear it. We know it. We live with it. The coronavirus or the SARS-CoV-2 has already gone through 200 variants, but we only heard about those 4, the South Africa, the Brazil, the UK, and elsewhere, because one, it is now the flavor virus. It is what everybody knows about, but also these variants have changed some of the traits, some of the characteristics of the coronavirus. These variants are adding to the transmissibility of the virus. What does that mean? That means it makes it spread faster. It makes it more contagious. which again brings us to the first point that I said. This is why we need to be fully practicing all the preventive measures, because now we have a more aggressive transmission that requires us to stick to our masks, require us to wear the mask properly. It's not going to be a da'une where it is on your chin, and it doesn't mean that you can have your nose exposed just because you like to breathe fresh air. We all, believe me, would like to breathe fresh air. But this is not the proper way to wear it. Now it is more important to wear it the right way. It is more important to use sanitizers to wash our hands. It is more important to have our distances, because these strains or these variants are more infectious. But what these variants are not, more virulent. That means they are not more severe. That means they do not cause a more severe disease or infection than the original virus, the mother virus, if you want to call it that. So the severity of the disease is exactly, it didn't change even with the new variants. But how fast it can spread has changed. And this is, again, why protection is still as important. And this is why we need to make sure that everybody gets that vaccine, because we want to establish the herd immunity and suppress the virus and its ability to mutate and change its characteristic to spread faster. So, when will Wayne County get fully vaccinated, and what is the plan? That is the biggest question that I probably get asked at least 10 times a day. The vaccine is in limited supplies for so many reasons. One, production and demand. These are new vaccines. They're being made every day. They're being made from scratch. And the minute they were approved, they were bought and they were put and sent to the market. Because of the limited supply, then you have one pie and now you have to slice it into all different slices. So the more people that want a piece of that pie, the smaller the slice is going to be. So imagine we have 300 million Americans that need those vaccines. Not all of them are going to get it at once. So therefore, there had to be a plan of rationing. There had to be a prioritization plan on who gets the vaccine first and who gets it second and who gets it third and so forth. So during this period where there is limited supply, those that need the vaccine the most are going to get it first. Who are the ones at risk? The doctors, the nurses in the emergency rooms, those that are dealing with the sick patients, those that are exposed to COVID every day, the ambulance workers, the emergency medical technicians, the emergency medical services that would come after 911 and deal with that. So those were the first population that we said they have to be vaccinated. So any shipment of vaccine that was received were reserved for those, and they were vaccinated. Then we said, okay, who are the next in line? The medically fragile, the elderly. And the elderly that are living in congregate homes, in nursing homes, on long-term care, these are even at higher risk because they are in groups, because they have medical conditions that makes them weaker, and they should be the second in line. And we said, great, the second shipment of vaccine that we got, we started doing long-term care, skilled nursing facilities, and adult nursing homes. And then they said the third priority should be anybody that provide health services for patients. So that immediately opened the door to people like Dr. Muna and myself and practitioners that are surgeons or pediatricians or primary care physicians, dentists, pharmacists, laboratories, endoscopy labs, urgent cares, dialysis, all those. Now, the bigger we're expanding that umbrella, what is happening? We're including more people, right? So currently, I have a list in Wayne County of 18,000 people that fit in that category, and that list is growing. We have been able to do 1/3 of that population, only 6,000, based on the vaccine supply we're getting. So remember, we did the frontline medical workers, we did the long-term care, and now we're doing what we call priority 3 in that group, and these are the medical professionals and the dentists and all that. But that list is growing. But we didn't want to wait until we finish this, because it's got to take us forever to finish them. And we know that there are other groups that are also going to be added, and we need to address those. And currently there are 3 priorities in what we call Phase 1B. Those 3 are also people that are going to be at exposure, and we need to address those. There are the public safety. These are the law enforcement, the police department, and firefighters. There are the educators, our teachers and staff that work in schools that are eager to go back and teach our children, and we want them to be safe. And then there are those that work in correctional facilities at the jails and prisons and the juvenile detention facility. Those 3 groups are going to be next in line. In fact, next week we're starting with the teachers. There are 20,000 teachers in Wayne County that want the vaccine. So you have 20,000 teachers and 18 health professionals, so that's 38,000. And then you have 3,000 police officers. That's now 42,000. Add to it others, and remember that, and Representative Hamoud would tell you, we get, at least my department, Wayne County Health Division, we get on average 6,000 doses every week. And we need at least to vaccinate 50,000. So that is slowing how fast we get to the general public. Then there are the 65 and older. Those are also a priority because they are, remember, the older are more at risk. And those are the ones that really we need to address those. There are at least in Wayne County 200,000 65 and older citizens. And we cannot do that at the health department on our own. We do not have enough vaccine to do them. It will take us years if we want to do that. So we reached out to our partners in the hospitals and the healthcare systems. And they all stepped up and said, we will take that population. So when you hear that, I called the health department. My parents are 70 or 75 or 66, and I called the health department, and they said they cannot help us. That is because, yes, we cannot help you, but if you call Beaumont or Henry Ford or St. John's or St. Mary or Garden City, then they are the ones that can help you because they chose to do that. Why did they do this? For 3 very practical reasons. One, probably 70% of the population, 65 and older, have a physician that belongs to one of those hospitals. So they're already their patients. They know them, they know how to get them, they know how to vaccinate them. Second, the hospitals received much more doses than the health department, and they can manage this population. Again, it doesn't mean someone calls today, they are tomorrow getting the vaccine. But the waiting period is at least not months. It might be a few days to a week. Third, which is very important in my opinion as a clinician, we're talking about a population that is very medically sensitive. And by that I mean they have other conditions that we need to care for. And for the very simple and remote possibility that anything can go wrong when they get the vaccine because they're so fragile, then it's best for them to get the vaccine in a healthcare setting rather than to get it through a drive-through or a walk-in in a big stadium. And this is why we decided we want to do this model, and this is why Wayne County is vaccinating the 65 and older through the healthcare systems. The last point I want to do, and I'm going to stop there, is talk about the safety of the vaccine. Again, so many rumors, so many so-called experts, so many Arab-speaking, English-speaking, any language-speaking so-called doctors would go on YouTube, would go on WhatsApp, would do a video and tell you all the horrible stories about the vaccine. Some say it is an invention by Bill Gates to control you. Believe me, Bill Gates doesn't need a vaccine to control you. We are controlled by our phones. They know exactly what we're doing. So they don't want to need to go to this very expensive technology so they can control you. Some say that you start glowing in the dark. I took the 2 doses, and I don't think I'm glowing in the dark. Let's turn off the lights to see if that is happening. Some say, so all this is nonsense. The vaccine is well studied, well evaluated, and it doesn't have any side effects that any other vaccine would not have. Some soreness at the injection site, maybe some would have high temperature, fever, sometimes chills for 24 hours, and it goes away. There are very few that have allergic susceptibility. That means they have known allergies that might react to some components of the vaccine. Specifically, the vaccine has a component that is polyethylene glycol, and if anyone that is allergic to that, then sometimes an allergic reaction, tingling in the tongue, or some itching or something. Very few, that is less than 2.5 per million, 2.5 per million, go into what we call anaphylactic shock. Anaphylactic shock means your body immediately goes into, after you get the vaccine, within 10 minutes, your body goes into a shutdown and you need to be given adrenaline. This is why people carry EpiPens. In all the cases, there has been 10 cases in 4 million vaccines given, and that's where we get that 2.5% per million, or 2.5 cases per million. In all those 10 cases, it was in people that had well-known allergies, that this happened to them before. So there is that susceptibility that we said. So my last point that I want to say, this vaccine has been now given to 20 million people in the U.S. Let's add to it another 50 million all over the world. So there are 70 million people that took the vaccine. And as of today, there hasn't been one single case of death that is confirmed to be linked to the vaccine. Not one single cause of death in 70 million people that took the vaccine. Which, Doctora, this makes it safer than aspirin, because we know people that take aspirin and die. And this is as simple as I want to put it. I really thank you for the opportunity. I know there will be a lot of things that you want to know, but I don't want to take all the time. Thank you very much.
Thank you very much, Dr. Hamami, for all the details that you gave. That was very helpful. Moving to our second speaker, Representative Hammoud, who will be giving us an update on the response at the state and federal levels.
Thank you so much. And wassalamu alaikum. Is this? So Dr. Hamami and I, we have a weekly phone call together. We actually have a weekly phone call with many of the stakeholders at the state, at the county, at our schools, to make sure that we are coordinating not just the vaccine distribution, but also keeping an update on how many cases are at our schools. Where is there an outbreak within our community? What streets or what neighborhoods are at a greater risk? And to me and my team, he's known as the coronavirus encyclopedia. And so he is an asset to this community, and we thank him for his work very, very much. Without you, I don't know where we would be as a public health department, so thank you so much. I've been asked to discuss what the state's response has been as it pertains to vaccine distribution. And I'll try to focus as much as I can on those points. Very early on, when we knew that the vaccine was in development, the governor and our state Department of Health and Human Services began to work on the logistics of the distribution of the vaccine. Not only is it difficult because of the number of doses that are available, it's difficult because of the refrigeration that's needed for these vaccines, specifically Pfizer and Moderna. Some of these vaccines have to be stored at negative 70 degrees Celsius, and those types of refrigerators are not widely available. They're not available at our schools, they're not available at our nursing homes or at our long-term care facilities, And so even accessing the technology to store the vaccine is very difficult and has been a part of the process, the learning process, in order to disseminate the vaccine. But we started to overcome that obstacle. The second thing that the doctor highlighted was you have only an X amount of doses. And it's not just that we're competing, and I'm going to speak as Wayne County. We're not just competing with Oakland County or with the city of Detroit because we have our own, they have their own public health department. We're competing with every single state across the country, and we're competing with every single country across the globe in acquiring these vaccines, which is making it that much more difficult. And so the governor issued several letters to the federal government, and specifically what she requested was two things. One, she requested the ability to purchase additional vaccines that have been set to the side. And two, she requested permission to use the storage that we had as second doses to be administered as first doses, because many of the the pharmaceutical companies have come out and said they're actually amplifying the number of vaccines they are going to create through and manufacture in 2021, which gives us the ability then to use the first dose vaccines now, because you get your second dose in between 21 to 28 days later, and by that time new vaccines will have arrived and we can administer those doses throughout the state. The way the state has determined how we will administer the vaccines is through our local public health departments. And so here in Dearborn Heights, and Western Wayne County, we will work through Wayne County Public Health Department. If you are a resident of the city of Detroit, the city of Detroit has its own public health department, and so I would implore you to reach out or reach out to them, go to their website to see how they're best administering the vaccine. And the other point is, at the federal level, there was a decision made that at all of the nursing homes and the long-term care facilities, our public health departments aren't technically responsible for administering the vaccines. They've reached out to CVS and Walgreens. And CVS and Walgreens are actually going into the long-term care facilities in our nursing homes, and they're in charge of setting up the appointments, acquiring the doses, completing the forms, and administering the vaccines to our elderly. And so, for example, at Henry Ford Village, over on Ford Road in Greenfield, they went in and to the special needs population, to those in the nursing home part of that facility, they already received their first dose. On January 30th, they will go back and give them the second dose, and they will begin giving the first dose to the long-term care residents of that facility. And then they'll have a third follow-up appointment to give a second dose to the long-term care residents. And if it's a very large facility, they're going to need several appointments because it's a very labor-intensive process, meaning that we need a lot of hands on deck, not just in terms of the refrigeration, but individuals who are volunteering to complete the form properly, and then healthcare professionals who are administering the vaccine. And so that's where the intensive portion comes in. I can tell you, as a representative for the city of Dearborn, there is an internal struggle for trying to get our fair share here in Wayne County. If you look at the numbers, I just looked it up right now, there has been nearly 1 million doses of the vaccine administered in the state of Michigan as of yesterday, which is quite an accomplishment. We've come to the point where we are now administering more doses than we are having cases. And that shift is really something that we like to see. However, what we've noticed is that Wayne County isn't receiving what I believe to be its fair share, and I believe the doctor would agree with me. We're not receiving our fair share of doses, and what we're currently doing, all the representatives of Wayne County have come together, and we've put together a letter asking the department to reevaluate the formula it's using and to reevaluate how many doses we are receiving as a county in order for us to speed up the process in which our residents receive the vaccine. But as it pertains to where do you go, how do you sign up, it was spoken to earlier. If you are 65 and older, please refer to your local health system. If you are a teacher, I know they are coordinating with the schools that you work at in order to get the numbers of who is signing up for the vaccine so they can organize a vaccine distribution through the schools so that we can try to open up our school system once it is safe to do so. I know a target has been given to us, but I think we should try to move accordingly once it's safe to do so. And the last question I've been asked to answer is, what is the federal government doing? I think it's safe to say that we had no vaccine distribution plan before January 20th of 2021. And that is the day in which the new president was sworn in. And I think it's safe to say that we have not had a national strategy around coronavirus for quite some time, unfortunately. But what we're seeing now is a shift in the mentality, a shift in the belief of science, a shift in the belief of that this is a global pandemic and that we need to appropriate all the assets that are needed to tackle this as quickly as possible. And so we're hopeful that with the new leadership at the federal government, that we will see an uptick, hopefully, in the amount of the vaccines that are manufactured and distributed, and that there will be more assistance to states. And one of those forms is not just the vaccine itself, but resources. Resources, whether it's unemployment resources, so that if you are laid off of work, that you're able to still be at home and provide for your family without being forced to make that decision of should I go into work and put myself in a dangerous position for my family in terms of exposing myself to the virus so I can earn an honest day's living to provide for my family? Or do I have enough resources so we can provide for now while trying to protect the family and our neighbors and our community? But also resources for our small businesses that are struggling. I think most recently, many of you heard, restaurants for many months have not been able to operate the dine-in inside of the restaurants. As of February 1st, that will change. There'll be a 25% capacity limit depending on up to 100 people, depending on how big of a restaurant you have. And there will also be curfew. You cannot operate dine-in past 10 p.m. However, you can operate carry-out, dine-out, or the tents that we see outside. And just one comment on the tents. Some people say, how is it possible to have tents outside that look like you're dining inside? Many of the tents that you see might technically not be allowed. There's a very specific regulation on type of tents that are allowed to be operated. And so I just want to flag that. We're not here to point the finger at any bad operators. It's a very difficult time for our small businesses, and I implore you all to support small businesses as much as you can. But those changes will go into effect come February 1st, and we'll begin to see dine-in again. And it's our hopes that as dine-in opens up, we just want to encourage individuals to still please mask up, even inside the restaurant when you're not eating, because it is when the mask is off in a setting like a dine-in setting where you are most at risk for spreading the virus. And with the new variant, it was spoken to, it's up to 50% more infectious. It is actually more dangerous for us that the new variant is 50% more infectious as opposed to 50% more deadly. If we do not take the right public health precautions, we would lose more lives because it is more infectious than more deadly. And so please continue to practice safe social distancing. Continue to avoid the large gatherings. Many of our venues are struggling, I understand that, but we're doing what we can to provide them with the grants and opportunities. And we're hoping to receive more federal aid so that we can pass it through. And at the state level, we just passed over $200 million for small businesses and grants. And so we're doing as much as we can with the resources that we do have. And with that, I will turn it back over to you, Dr. Mona.
Thank you, Representative Hamoud. And the final word is for Maulana Sayyid Hassan.
Bismillah ar-Rahman ar-Rahim. First, I would like to thank the panelists, Dr. Hammami and Brother Abdullah Hamoud, for honoring us tonight and joining this panel. I would like to thank Dr. Maha Al-Husseini for moderating. My role tonight is not to speak about the scientific aspects of the vaccine, because this is not my job, this is not my expertise, and we already heard some enlightening words from Dr. Hammami and Brother Abdullah Hamoud on that regard. My role is to speak about the Islamic and religious implications on whether or not we should take the vaccine. What does Islam say about the vaccine? Should we take the vaccine or we should not? Many people are calling and asking these days, what is our responsibility Islamically, morally? And here is the answer, my dear brothers and sisters. There are two guiding factors that rule this issue in Islam. One, is that we have a principle in Islam that says saving life is mandatory, no matter what. And when it comes to saving life, if saving life conflicts with any other obligation, as big as salah, for example, or any other obligation, saving life proceeds. So, for example, if I'm about to pray, and I just have 10 minutes to finish my prayer before sunset, and there is a child drowning in the swimming pool, assuming I know swimming. Unfortunately, I personally don't know how to swim. I need to cut my salah, I need to stop my salah, and immediately go and save this child. Why? Because saving someone's life is more important than prayer. As important as prayer is. So this is one principle that our scholars would emphasize. And the Quran says, وَمَنْ أَحْيَاهَا فَكَأَنَّمَا أَحْيَا النَّاسَ جَمِيعًا. He who saves one life, it is in the eyes of God as if he has saved the entire mankind. The second principle is, when it comes to issues that are not purely religious, where do we go to? From an Islamic point of view, who do we go to? When I experience a medical problem, who should I go to? Should I go to the carpenter? Should I go to the grocer? Or to the taxi driver? With all due respect to those individuals. Islamically, I have to go to a physician. Allah says in the Quran, فَاسْأَلُوا أَهْلَ الذِّكْرِ إِن كُنْتُمْ لَا تَعْلَمُونَ. When you do not know about something, go to the expert. That's why you go to a sheikh or a sayyid or an imam when you need to deal with an Islamic issue. But when it comes to your health, you go to the doctor and you listen to the doctor. When it comes to other issues, business, and you have a business issue to discuss, you go to a businessman. When you have a legal issue, or when you are in legal limbo, you go to a lawyer. When it comes to this issue, the issue of vaccine, should we take it or not? I'm not the expert on it to tell you it is good or not. This is the expert. The expert tells you, yes, you should get it. According to the data we have, the scientific data we have, you must take it because it prevents a tragedy. And if you do not take it, given the fact that there is no cure, no medication proved for COVID has been invented, then you must take this vaccine in order to save your life. Based on that, my dear brothers and sisters, Islam says if vaccine is the only way to prevent getting infected and ultimately avoiding terrible consequences such as death or dying, then it must be taken. Sayyid al-Sistani, the Grand Ayatollah and the highest Shia scholar in the world, has been asked recently about taking the vaccine, and the question was put this way, that if the vaccine is approved by medical authorities around the world, and it is the only way for us to put an end for this pandemic, what is the Islamic obligation requires? The Sayyid says, your Islamic obligation requires you to take the vaccine. Now, if you take the vaccine and something happens to you, then what? I'm not in charge to answer that question, nor I'm responsible to answer that question. Why? Because you know that every medicine you consume, it has side effects. Hardly you find any medicine that doesn't have side effect. Eventually, any medicine you use, it has side effects. And the side effects vary from severe to mild to minor. Now, I'm not in charge of assessing the side effect. It is also the expert who will assess that. But again, does this side effect should stop me from taking the vaccine? No. Because again, the risks of not taking the vaccine would outweigh the risk of taking it. So once if it is offered to us, once it is available, without za'bara, without going behind lines and using our connections and ties to get that, yes, you should take it for yourself and your family members. And remember, my dear brothers and sisters, some people say, I don't care about my health. It's not only about you. There are other people who live with you in the same house, the kids, the elderly people. And you can be the vector, you can be the vehicle with which this disease is being transmitted. So you are not responsible for yourself only, but also for those who are around you. So you better take precaution. Now there is a question I would like to mention. I would like to bring up that question to you and give my answer and also get an input from Dr. Hammami. There are rumors that one of those two vaccines, either Pfizer or the other one, Moderna, contains pork product. As far as I know, that's not true, but again, I would love to hear that from Dr. Hammami. But remember, even if tomorrow we find out that yes, it does include pork product, this does not make the vaccine haram. Why is that? Because in Islam, eating pork is haram. But to take a product of the pork and add it to your bloodstream, there is no evidence in Islam that this is haram. So basically, even if that's true, still it does not make the vaccine haram. But I would like, after I'm done, I would like to be the first one to ask Dr. Hammami if that's true or not. Finally, my dear brothers and sisters, one of the problems the new technology, the smartphones had brought for us, one of the new headaches is spreading false rumors and disinformation. So I think most of you have this app, the WhatsApp, just like I do. And I receive, without exaggeration, I receive hundreds of notifications on weekly basis on my WhatsApp. Now, some of the things, I can say a large portion of things we get in our WhatsApp are false information. Some people, I have seen them repeating things that are baseless, and there is no evidence to support what they say. And when you say, what is the source of your information? They say, WhatsApp. So what? WhatsApp is not a medical authority. It is not a religious authority. People exchange those video clips, sometimes recklessly, irresponsibly. They make up things and they then pass it on, and someone sitting, and this is what bothers me, that some people seems that they have no job other than forwarding those messages to others, as if it's been revealed to them by Allah that this is your responsibility. My responsibility is not to forward any junk that I receive on my WhatsApp. I need to be careful not to contribute to this campaign of disinformation and misleading. So not anything you receive in your WhatsApp, any video clip, any statement by someone sitting somewhere making statement just like our friend Dr. Hammami mentioned, would say something about it, khalas, we take it. We should abandon. We have a disease in this community. It is called conspiracy theory. Many people believe in conspiracy theory. Anything you ask them, why this church used a green carpet, maybe this is a sign of maybe conspiracy that they wanted to conquer the United States by pretending they are Muslims. This is all nonsense, my dear brothers and sisters. We should not follow the rumors, false rumors, and we should rid ourselves from the conspiracy theories that everything someone is doing, then there must be an ulterior motive behind it. Either Bill Gates, or the Zionists, or Wall Street, or this guy, or that movement, or this group. We need to be more realistic, and we need to not allow this wave of disinformation would mute our responsible reaction toward the crisis. Thank you so much for listening. Wassalamu alaikum wa rahmatullahi wa barakatuh.
Thank you, Maulana, for your religious and spiritual guidance. We're going to open the floor now for questions and answers. I've received several questions so far, so I would like to ask the speakers if we can keep the answers to a minimum, please.
Sure.
So the first question we have is for Representative Hammoud. What can we do as citizens to help push for more vaccines in Wayne County?
Very good question.
Very good question. Thank you so much, Dr. Maha. For citizens in Wayne County, what I would ask you to do, if you don't live in my district in the city of Dearborn, because I'm sitting right here before you, reach out to your state representative. Reach out to your state senator if you know who they are. If you don't know who they are, reach out to my office and we'll connect you with them. When the representatives hear from you directly, it's more meaningful. It lights a fire under them to make sure that they're advocating for the issues that you care about. I can tell you in my office, if I just get 10 emails or phone calls on the same issue, we immediately elevate it to the highest priority. So I would ask you to reach out to us, reach out to your state representative, your state senator, and ask them to request more vaccine doses and a greater equitable portion to Wayne County residents so we can administer vaccines much quicker.
Thank you. Dr. Hammami, what is your opinion on the upcoming Johnson & Johnson vaccine?
As we know, there are several vaccines that are currently in what is called stage 3. There is the Johnson & Johnson, there is one that is called Novavax, and we all heard about AstraZeneca that is being used in the UK. These are all at stage 3. That means they're being evaluated as the last stage, and they will or will not, based on that evaluation, receive emergency authorization use. I believe this is a good thing to have more vaccines. It diversifies the pool that we're working with and certainly adds to the volume. As far as what I know about it personally, I know that it's, again, an effective vaccine, probably not as high as the Moderna and Pfizer, but it still has proven to provide benefit and protection. Of course, we want to wait to see what is the final verdict from the Food and Drug Administration and some of the final evaluations.
Perhaps Dr. Hammami could answer this question. How would you address those who don't trust a mass-distributed vaccine because of conspiracies or misconceptions?
That's a tough question. We all believe in what we believe, and sometimes we're passionate about what we believe in. Again, I say everything is through facts. So back to Imam's question about whether any of this vaccine or any other drug would contain pork products or animal products and all that. The easy answer is check it out. You know, the two vaccines, the ingredients the package slip, they are on the CDC website. Nothing is hidden. Go through and check if you do not believe what people are telling you. Go through and check the ingredients and see whether it says anywhere it has pork fat or pork serum or whatever, which I know that they don't. But again, seek the knowledge by yourself rather than to wait for someone to tell you something and you say, yep, okay, that's what I'm going to be doing. So whenever you believe that something is, you have doubt, whether it's medical or similar to how you deal with everything, anything that you doubt, you go and seek the facts. You do your own research. And that journey to find the truth is the most fulfilling in everything, even in science. That journey is going to make you a believer, and it will not affect your convictions because somebody else told you so. So I would say go and seek the facts and don't repeat whatever is fed to you.
Thank you. Either Dr. Hamami or Representative Hammoud. How long will it take for most of the population in the U.S. to have herd immunity?
That's a great question. I think the question that we need to answer in order to come up with that question is how many doses will be provided to us over these next several months. In order to achieve herd immunity, especially with the new COVID variant, the public health professionals are saying traditionally you need 70 to 80% herd immunity. Now they're saying we might need upwards of 90% plus. It's not going to be difficult to administer the doses to residents who we can get in contact with. The difficulty will arise in administering vaccines to those residents who might not have identification cards, to the homeless population, to the extremely vulnerable population that might be living in the streets where it's hard to get to residents who might not speak English as a primary language and resources are not provided in another language to educate them on the importance of signing up to receive the vaccine. That's the population that's going to fall through the cracks. And so we need to do what's best once we have an appropriate size, an appropriate vaccine volume in order to get it out as quickly as possible. I don't have a timeline. Manufacturers are changing every single day how many doses will be made available. And I think it's up to the federal government to see how much of that vaccine that's actually manufactured they purchase and then provide to the states.
Dr. Hamami, is there an association between the vaccine and infertility?
No. Okay, let me add more because the answer is no. There have been rumors that there is an association. All the studies that were done so far did not confirm any of that. There are no indications the way it acts, whether the virus itself or the way the vaccine itself is made, does not indicate any correlation that it can affect either male or female infertility. So the answer is no.
If I can just add one point, and it's just on the data validation. When you're doing your own research, use validated websites. Look to the public health professionals. If you go to a website called parentsagainstvaccines.com, they're probably not going to post information that talks about, from an objective standpoint, and why this vaccine is a public health prevention method that we should be using. Go to the CDC, look up the research articles, look up the medical journals, lean on the public health professionals like Dr. Maha, like Dr. Hamami. They're the ones who are doing the work. They're out there on the front lines each and every single day, and they know this far better than any of us do, and they know where to go.
Question for Dr. Hamami. If someone has an egg allergy, can they take the vaccine?
They have an allergy for what?
Eggs. Egg allergy.
Any allergy?
Egg.
Egg. Oh, I'm sorry. Egg. Oh. No. So again, let's talk a little bit about the allergies because this has been probably the most looked at. Oral allergies, whether you're allergic to food or even some of the oral medications you take, such as penicillin or allergic to antibiotics and all that, there hasn't been any severe reaction related to those at all. So far at the health department, we vaccinated 16,000 people, of which I personally was at the site when they brought me someone and they said they have allergies to penicillin. I think I have 5 people that did disclose that they have allergies to penicillin, and we did vaccinate them, and nothing happened. Of course, there is always what we say. We, as those that are vaccinating you, we have 5 minutes encounter with you. We don't know you enough. So if you have any medical conditions, the best one to ask is your doctor, who knows your condition the best. And go and consult with your doctor regardless what you think. And he or she believe that, yes, you should take the vaccine, then that should be your go ahead and don't hesitate. Now, back to the question, oral allergies, food allergies haven't been associated with any severe allergic reactions. Again, those that have severe allergies that cause them to carry EpiPens, those that are allergic to some of the components of the vaccine, those that get allergic after, let's say you go and you do an endoscopy and they inject you with a dye, the iodine, there has been some correlation, but nothing severe. Specifically, one component, which is polyethylene glycol, which many of us know it as antifreeze. It is what you put in your car so it doesn't freeze. That polyethylene glycol has been shown some relationship with those allergies. Again, when we give the vaccine, we make sure anyone that gets the vaccine remains on site for 15 minutes. We monitor them closely. And those with history of allergies, we keep them for half an hour to observe them. So far, against 16,000 people, we had 2 or 3 that I don't think they had an allergic reaction as much as they had an anxiety reaction. They were so excited and anxious and scared at the same time. And after they got the shot, they had like this moment. And this is where they felt something funny, and we immediately told them after the half an hour, if you're still feeling not feeling good, then let's take you somewhere. So we didn't have anything serious in terms of severe allergies.
Thank you. Dr. Hamami, why do you need two doses? Is the second dose a booster?
Whatever you want to call it is yes. So again, let's go back to the simple vaccine that we all know. Your children, they get at 2 months, 4 months, and 6 months, the same vaccine. These are getting your body to build more and more and more of the system that's going to fight this vaccine. The first dose of both vaccines have shown to give you 60% immunity. The second dose is going to give you 95% immunity. It is part of how our body reacts to something that they get for the first time, and then something that they get the next time, and it just completes the system. So it's similar to the first time you ever drank coffee. You probably had a full night that you were awake. The second time you drank coffee, you probably weren't awake the whole night. And this is how we acclimate your body to these things. And that's why you need a second dose.
Thank you. Representative Hamoud, are restaurant staff employees considered frontline workers and therefore able to get the vaccine?
So I believe, and correct me if I'm wrong, Dr. Hamami, they would not fall in the phase 1A for the healthcare professionals, but I believe they come in at the end of phase 1B, beginning of phase 1C, where frontline workers who are in a higher risk environment would be able to then sign up to receive the vaccine.
Yeah, you're right. So phase 1B is very, very broad, that it's called essential workers. And we mentioned currently the top 3 that the governor said we need to work on. These are the police officers, the teachers, and those that work in correctional facilities. But that group 1B has 16 different categories in. I think number 5 or 6 on the line are what are called agricultural and food workers. So under that you have those that work in the supermarket, those that work in food factories, those that work in farms, those that work in restaurants, those that work in cafes. So imagine now that we are reaching this population, the amount of people that we need to ensure that we can vaccinate. And this is, again, we're going step by step. You'd be happy to know that, and I don't know how that bode for Abdullah and those of us at the county, government employees are number 10, so they are not going to get it before anybody else. Government employees are ranked number 10 in that list.
And let me say, for those receiving the vaccine after your first and second dose, the data is still not conclusive as to how long the immunity lasts. Moderna has suggested it might last only 1 year. Pfizer is still speculating as to how long it will last. So I don't want this to be a new conspiracy theory that they're giving us something every single year. As we still monitor the data, as we monitor those that receive the vaccine, it's very likely that this might be like the flu vaccine, where you get it every year or every 2 years. We're not sure yet. And so just understand that fact now. So when you see the article that comes out and says this vaccine only provides you immunity for X amount of time, you have to retake a booster at this period of time. It's not a conspiracy theory. This is a new type of coronavirus. We're watching the data. We're watching those that had coronavirus and that have received the vaccine. And as the data emerges, it begins to become public.
And it's quite normal. We do take the flu vaccine every year, right? Every year we say take the new vaccine for so many reasons. One, because it provides you immunity for 1 year. Two, remember we said that virus goes into different evolution. So every time we modify the vaccine and we take it another year. And I suspect, similar to what Rep. Hamoud said, I would suspect that COVID-19 is going to be a yearly thing. The vaccine for COVID-19 is going to be a yearly thing that we will take every year. And I don't see any problem with that. It would be part of how we take the flu vaccine, how we take the shingles, how we take all that. We take a lot of things on a yearly basis just to protect ourselves.
Okay, this question is either for Representative Hamoud or Dr. Hammami. Is it true that hospitals receive a financial incentive from the government when someone gets admitted with COVID? And is it true that because of this incentive, hospitals are overinflating the number of COVID deaths?
I would immediately say it's false. If we look at what happened early on in the pandemic, take Beaumont Wayne, for example. They suffered a great financial loss because of the COVID pandemic, where we had massive layoffs and closing down of units within the hospital at a time where we needed most. Doctors are, we have Dr. Maha, we have Dr. Hammami. My wife is a doctor. I see Haja Najah, who is a healthcare professional as well. These healthcare professionals are not on the front lines risking their lives for $1. They're out there risking their lives to ensure the public's health. And any insinuation that hospitals are inflating numbers or inflating deaths in order to receive more resources is just absolutely false. It's another conspiracy theory that was floated out there, but if you look at the numbers, it's 100% not the case. Hospital systems and health systems across the nation are actually struggling at this point in time, because what's happening is, because we had a severe restriction very early on all of the elective procedures going into the hospital, that pipeline actually ended. And people are not going to receive the preventative care services that they need to anymore. People are too afraid of coronavirus to go see their primary care doctor. People are too afraid to go see their mental health provider. People are too afraid to go into the hospital to receive their colonoscopy or endoscopy that's required. And that's what's causing a lot of these hospitals to struggle currently. There's no additional bonus that's given if you have a COVID-19
Absolutely.
yes.
Let me add to that.
COVID-19 diagnosis. That's what I want to say. There we go. Thank you.
Right. Before I rejoined the county to have the response for COVID in October. Before that, I was for 3 years working at Trinity Health as Senior Vice President for Community Health and Wellbeing. When COVID hit, and Trinity has 95 hospitals in 22 states. The hospitals were not compensated for treating COVID cases.
Mm-hmm.
Nobody gave money to treat COVID cases. Add to it what just Abdullah said, all elective surgeries were shut down. Everything that was not important was shut down. Trinity's annual revenue is $20 billion with a B. Dropped down to $15 billion. So they lost 5% billion from March till September because of COVID. So it is not something that people are making profit out of. And they will be more than happy to tell you there are no COVID and we want people to come and get their elective surgery. And they want them to come back and see their physicians. Dr. Al-Husseini works at Petroendocrinology with my dear friend Dr. Al-Hilli. At some point, they didn't see any of the patients because patients were afraid to go see their doctors until they established the telemedicine system and started providing some of the advice. Till now, their patient population is dropping. So the medical industry did not benefit from COVID. I can tell you that with full certainty.
This question is for Sayyid Hassan. Sayyid, what do you say to those people who say our life and our death are all in Allah's hands anyways? Why should we all wear masks? Why should we take a vaccine? Let's just trust Allah.
That's a very good question. Yes, we should trust Allah subhanahu wa ta'ala, but trusting Allah does not mean at all to go reckless and to let our guard down. The Prophet sallallahu alaihi wasallam, when he saw a Bedouin guy coming to the masjid and leaving his camel untied, and the Prophet says, ask him, why don't you tie your camel? Because when you come out of the masjid in half an hour, you may not find him. He says, I atawakkalu ala Allah, I rely on Allah subhanahu wa ta'ala. The Prophet told him, i'qal wa tawakkal. Tie your camel first and then rely on Allah subhanahu wa ta'ala. Relying on Allah doesn't mean we go reckless. I can go now out and stand right in the middle of 4th Street and let cars hit me and I say, you know, it's up to Allah subhanahu wa ta'ala. If Allah wants me to be hit, I will get hit. That's not true. Allah subhanahu wa ta'ala tells us you need to take care of yourself. You're not supposed to cause harm for yourself. وَلَا تُلْقُوا بِأَيْدِيكُمْ إِلَى التَّهْلُكَةِ. Allah says, do not cause your own destruction with your own hand. So I cannot be reckless and cause my own destruction and then I blame it on Allah subhanahu wa ta'ala. Allah subhanahu wa ta'ala is the protector. And He has our trust, but that does not mean in any way or shape that this should make us go not cautious. We always need to use a precaution and we need to do our own due diligence to protect ourselves, then trust God. If I get sick, I need to go to the doctor. I cannot sit home and I say, if Allah wants me to heal, I will heal. Musa alayhi salam got sick and Allah subhanahu wa ta'ala told him, Prophet Musa, go to the doctor. When Prophet Musa asked Allah subhanahu wa ta'ala, Ilahi, you're the one who offers healing. Why I should go to the doctor? Allah told him, this is how my plan works. You go to the doctor, he prescribes you a medicine, and then I will help by offering my healing. So it is part of our faith to believe that trusting God is to do our own due diligence and not to let our guard down.
Thank you. This question is to Dr. Hammami. Do you recommend pregnant women to receive the vaccine because of the possible adverse effects on the child's brain and autism?
This is a very good question. And so far, the two groups that should not get the vaccine are those that are under 16 years of age for Pfizer and 18 years of age of Moderna and pregnant women. The only reason is that when they did the studies, they did not include those groups. So we don't know anything about how they would react if they get the vaccine. There are studies that are happening. There are studies that will happen that are now going to take those groups and recruit them and see how that happens. As of today, as of what we know with the CDC recommendations, under 16 for Pfizer, under 18 for Moderna, and no pregnant women will receive the vaccine. Until that changes, this is what we're operating as.
Another question for you. Can you speak about the story from Norway about 25 deaths after vaccines were provided?
No, I can't, because I don't know that this happened. And I'm not sure if that is true or not. And there has been some theories of, I think it was some older population that eventually, when they investigated it further, they discovered that they died because they were old, because they had other conditions. They didn't die from the vaccine. So again, there is a difference. We learn in public health what we call the causality. So one theory, they tell you, smoking can cause people, smoking can increase car accidents, which doesn't make sense, right? But how they did it, they said, okay, most of smokers also drink alcohol. Now, drinking alcohol would cause car accidents. So now you're making this triangular cause, you're eliminating the real cause, and you're making that association. So it might be very possible for someone with a heart condition to die after taking the vaccine. But did he or she die because they took the vaccine, or is it because of their heart condition? And I think this is what we're talking about here.
Thank you. I'm going to forward this question to Representative Hamoud. We have happy hour at many restaurants. Why can't we have happy vaccinated hour to get people more comfortable in getting out?
That's a great question. I think we're doing the best we can to try to educate the population on the importance of the vaccine. And I wish we could have happy hours where you can pull up, at one of our restaurants to get something to eat and get a vaccine while you're there as well. Unfortunately, the limiting factors is going to be the number of doses that we have available. And as Dr. Hamami spoke to earlier, the priority list. There are vulnerable populations that we need to get vaccinated immediately. And let me also add, though, that when you do get vaccinated, inshallah, you still have to wear a mask. You still have to do all of the other public health preventive measures, avoiding large gatherings, wearing the masks, until we reach a level of herd immunity. Because receiving the vaccine does not prevent transmission if you do have COVID. It's very important to note that. Even if you have the vaccine and if you have COVID, you can still transmit COVID. So I do want to highlight that fact as well.
That is very true. Yep, thank you for saying that. Now, there might be a big happy hour in the summer, so people, based on the estimates and the production of the vaccines and the potential of having new vaccines, what is estimated for moving to second stage or phase 2, where everyone can go get the vaccine, is probably going to be late summer. We're hoping maybe July, August, and that might be where we will have those big parties where everyone is getting vaccinated.
This question is for Dr. Hamami. You indicated that the technology used to produce the vaccine has been there for a number of years. That's why we didn't need more than 1 year to come up with the COVID vaccines. So what is the difference between the 4 to 5 vaccines made by different countries?
I know that there are several vaccines. There is the Chinese vaccine, there is the Indian vaccine, I think there is a Russian vaccine. I do to claim ignorance a little bit. I don't know enough of the details. Some of them are using the old technology, which is taking particles of the vaccine, proteins of the vaccine, injecting the body and making the body produce antibodies against it, which is still an effective way, but I don't have enough on the background of the science that went into that to tell you whether they're more effective versus this. I know that the messenger RNA technology is now the future of vaccines because of how simple it is to just add to that messenger. So messenger is really a messenger. It's like sending a message with a genetic code and asking your body to do this or that or the other. So as soon as you can change the code and send it to your body, it can build a protection against anything that you want it to do. Versus the old traditional way, which is still valid, but it requires a little bit of time and requires also more time for your body to build those antibodies to fight the vaccine.
Okay, one more question for you. I'll finish this one more question and then we'll open it to the floor. What is your opinion on people who take steroids, so immunosuppressants? Can they take the vaccine? How about people with autoimmune disorders? And the last category, severe asthmatics.
Yes, yes, and yes. Because, again, remember what we talked in the beginning. Those that are medically fragile, those that have underlying conditions, those that do not have 100% health are the ones that are going to be more affected if they catch the virus. Therefore, they are the ones that need to be vaccinated first. There is category 1C, as Reb Hamoud mentioned. These are anyone between the ages of 16 and 65 that have underlying conditions such as what you said. They have immune deficiency or autoimmune diseases, or they have asthma, or they have diabetes, or they have, all those are more at risk and they are one step ahead of the general public. These are more important to take the vaccine than those that are healthy. So yes, they should take it.
عليكم السلام ورحمة الله.
تفضلي. طبعا الفاكسين مركب خصوصا ليهاجم، مثل ما حكينا، يهاجم المستقبلات اللي على الفيروس لتحمي الإنسان لما بده ينصاب فيه. كعلاج يعني الشيء اللي ذكرتيه هو مفيد لأي إنسان. هلا التعمير اللي طعمتيها أنا بصير مثل البطل مثل الأسد. طبعا أهم شيء لما الإنسان بيمرض هو إنه يكون جسمه قوي بدرجة كافية لمقاومة أي مرض، إن كان هو فيروس كورونا أو فيروس ثاني. الأشياء اللي حضرتك ذكرتيها هي بتساعد الجسم إنه يكون بصحة تامة وقوي ليساعد على الشفاء. طبعا هل هو بديل عن علاج بالأدوية وعلاج بأدوية متخصصة؟ طبعا لا، بس ممكن يكون الحالة اللي وصفتيها ما كانت كتير شديدة، احتاجت لأنه يأخذ أدوية مضادة للالتهاب أو أدوية مضادة للفيروس. بس بالطبع كل شيء ذكرتيه شيء مفيد. الحمضيات سيدتي، الحمضيات هي عبارة عن مليئة بفيتامين سي ومواد تزيد من مناعة الجسم، وبالتالي أي شيء بيفيد أنه يقوي المناعة بيفيد من محاربة الأمراض. بس نرجع منأكد أنه حدا بيلزمه لنفرض أكسجين وعلاج، قد ما أعطيناه عصير جزر وبرتقان وليمون واللي بدك يا ورمان، أي شيء بتلاقيه عصري راح يضل بده يلزمه أكسجين. تسلمي شكرا.
Thank you.
شكرا.
Inshallah.
آمين.
Thank you.
آمين. شكرا.
Go ahead.
Do you want to, if we pause there and let him answer those
Yeah.
first?
Very good questions. Let me answer them very shortly. Your first point makes a lot of sense, and it is worth debating, but I won't go into full debate. The reason this is called emergency use authorization, not because it cut corners in the scientific process, it cut corners in the regulatory process. It cut corners in how fast the advisors got together and evaluated everything and all that. So that's where the emergency indication comes in. Now, once everything is clear and all that, this is going to go back and be evaluated from a regulatory perspective in a more thorough way, and it will no longer have that EUA. But that is no indication whatsoever that there has been some bypasses for safety or for some of the scientific processes. The second point about teachers, I don't know if anybody heard you. The plan is, and the governor is encouraging all students to go back in person March 1st. And if our teachers are not all vaccinated, then how safe that is. So we are planning to vaccinate. In fact, next week, we at Wayne County we're going to start giving vaccines to teachers, again, on a priority list. We're starting with those schools that are currently in person, where they have classes, versus those that are remotely. Depending on how much vaccine we do, I believe I believe we might get to March 1st with at least 80% of our teachers vaccinated. Now, let's say not all teachers are vaccinated, because there's not only the factor that we don't have enough supplies, but we have teachers that say, just like everybody else, they say, well, I don't trust this vaccine, I don't want to take it. Now, those are going to be responsible for their own decision, but those are going to create that, what Representative Hamoud was talking about, that 80% versus 20%, 80 vaccinated versus 20% vaccinated. If we have only 20% of our teachers vaccinated because they chose not to be vaccinated, that's not good. And if they have to go back to the school and they have to go back in class, they cannot use the excuse that it is not safe anymore, because we're giving you a tool that is very safe and you decide not to do it just because of a video you saw or an opinion you have. So let me stop here before I get myself in trouble. But even if, let's say, there was no vaccine whatsoever, there are mitigation processes that we put in schools that are ensuring a safe environment for both the teachers as well as the students. Those are going to still remain in place even if everybody is vaccinated. So remember the Swiss cheese model? So now you have vaccine, you have the mitigation processes, you have the masking, you have the reduced class size, you have the hours, the 2 shifts and all that. That is going to create a safe environment if we go back in person by March.
Yeah. So I'll start with the second question first. Was President Biden said we'll open up centers to mass vaccinate people. I think if you look at the city of Detroit, they're working in the old Cobo Hall, the TCF Center, where they're trying to organize a mass vaccination site for residents of Detroit. I think as the vaccine becomes more widely available, we'll see possibly centers like this pop up across the state. Or what might be more likely is currently we have a lot of drive-through testing, COVID testing clinics. You might see many of those arise. We have one at Honeyport Centennial Library. We have one throughout Dearborn and throughout several other cities. So I think that's the more likely option for receiving the vaccine. To your first question about trusting the logistics and those in government, I don't want to say don't trust politicians because I fall into that category, unfortunately. What I will say is have faith in the public health community. Have faith in those who are at the head of the Health and Human Services Department at the state of Michigan that have been doing a phenomenal job. Have faith in Dr. Hamami, who's at Wayne Public Health Department. Have faith in Dr. Maha, who is a physician in her own right, and the fact that they are prioritizing the public's health. When it pertains to logistics, we are doing all we can to prioritize the most vulnerable population first, and then try to disseminate the vaccine to the remainder of the population. I mean, I myself fall into one of the last categories, and I'm not trying to skip lines, as was mentioned earlier. I'm trying to be patient and wait my turn and make sure that those who need it now get it first. So we each have a role and responsibility in this as well.
Thank you, Representative. I think we're gonna wrap it up for the night. Maybe you can ask it after the program, so that. Okay, go ahead.
Regarding your question, Abu Ahmed, I would say yes. The question was, would you take the vaccine yourself once it is offered to you? Yes, I would take it once it is available and once I have access to it. I myself, I plan on taking it. My family, they have mixed feelings about it. Some of them say they would like to take it, and some say we would like to wait a little bit more to see if more results coming from the vaccination campaign. But I personally, if it's offered to me, I will take it.
Okay, thank you. This brings our program to an end. I would like to thank each of our panelists for all the details and knowledge and clarifying all the misinformation. And I also would like to thank the members of the Health Committee for doing work behind the scenes and putting this panel together, including Haji Najah Bazi and Sister Maya Murtada. I want to thank the MYC volunteers for their help tonight. And most importantly, thanks to all of you for attending, as well as those who were following us virtually. Inshallah, this session was helpful and useful, and we pray for these challenging times to come to an end soon, and we pray for the quick recovery of those suffering from COVID-19, and inshallah we all meet again soon in better times. Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum assalam wa rahmatullah. Also, I would like to thank the panelists, Brother Abdullah Hammoud, Dr. Hammami, Sister Maha Al-Husseini, and also I would like to thank the Health Initiative Committee here at the Islamic Institute of America, headed by our Sister Hajj Najah and Sister Maya Murtada. I was hoping that we can also hear from Hajj Najah as well, since she is heavily involved in community affairs, and she told me today she was elected or selected by Governor Whitmer as member of which committee, Hajj? The committee overseeing the distribution of the vaccine? I'm sorry?
Protect Michigan. The Protect Michigan Committee.
I see, Protect Michigan Committee. So congratulations, Hajj Najah, for being picked by the governor for that position. We really wanted to hear from you, but unfortunately, I think we have come to the end of our program. But thank you so much, Hajj, for putting this event together, you and Hajj Maya. And thanks to the MYC brothers and sisters who also helped pulling this event together.